pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right. Well, thank you all for joining us on an extra meeting this beautiful evening. So this meeting was called for a special budget approval that was required to us by the auditor. So I will hand over that discussion to Ms.
Okay,
Paul.
I'll take it from here.
Thank you.
So, as you guys know in my email, the auditors told us on June 1st that we had to have the budget submitted by the end of June. And of course, it requires board approval for us to do that. So this is just the 2024 preliminary budget. Of course, we all know with Health First Funding, things might change, and the auditor is aware of that and okay with that. So this is just a preliminary budget at this time so that we can present it to the auditors. Do you guys want me to go through this in detail? Did you have any specific questions when you looked at it?
I have no questions.
Seems clear.
So of course, I'll just kind of go through what the different funds are real quick. The health fund is our primary fund that we work out of. Health maintenance is one of the funds that comes from the Indiana State Department of Health, along with the trust fund. This is a grant that we receive for our emergency preparedness. This one here is an immunization grant that we receive. This one here is a supplemental grant that we receive. I'm sorry if it's a little bit squished, there's just so I can get it all on here for you. As you notice, there's lots of places where I show increases and decreases. The decrease would be because we really haven't been using it consistently. The increases are all for outreach, for the most part. This is our COVID testing grant, which we're no longer receiving. You'll notice we're considerably less in that this year. This is our workforce development for school liaisons. This is our new lead grant that hadn't been updated when you received it last. And this is how we broke it down. Pretty similar to the last one. We just added another equipment line that the county council approved at our last meeting to purchase some equipment for lead testing. So that's all we've got.
Pretty straightforward. Motion to approve this budget, then to pass forward to the county auditor. Dr. Fleming.
A second.
Thank you, Ms. Soltich. Approve? Doctor?
Pardon?
We're voting, yeah, yay or nay?
Yay, that's
Yay.
fine.
Okay, so I think we have a 7-0 vote to approve.
Yes.
6-0?
Sorry, a 6, you're right, we're down a person, yes.
Okay, terrific.
Very nice. So that was the only thing on the budget, but we do leave, on our agenda, but we do have, anything more to add?
Yes,
Yeah.
one other thing. So hopefully you all had a chance to read your email today. I'm very sad to tell you that Sheila Paul, our administrator, for the past couple of years is leaving us to join the Indiana Department of Health in the regional administrator position, which is a new position that was also kind of set up by the wonderful legislation that we have for the state. Unfortunately, it's taking Sheila away from us. So I have, according to our employee handbook and HR, I have chosen to promote from within. So I'd like to appoint Carrie Geschwind as our next health department administrator. She has been with us for almost 5 years in the foods division. I think all of you have had a chance to meet her. She is a remarkable person, a visionary, a leader, a great manager of people, and will do wonderful for this time in this position. So I'm really happy to announce that. However, I understand that we also need to have a confirmation by the board, as Jessica brought up in a return email, if you had a chance to see that. So the next time that we can put that on the agenda will be August. So in this situation, then we will go ahead and place Carrie and have her as the interim health department administrator until we can have it on the agenda for a vote. So, but she will get started with Sheila this week and learning the ropes, and especially around budget time. This is a really good time to get involved. So please welcome Carrie, and I'm really excited to work with her.
I have to say I was upset to read today that we're going to be losing Sheila, but as I was reading it, the first person that came to my mind to take that position was Carrie. So as much as I'm disappointed but proud and happy for you, I couldn't think of a better person to fit that role. Awesome.
In the meantime, if I can make a comment, I think I love Carrie's energy. I want to make sure we don't lose you. I also want to make sure you're properly supported through this process, since we have a monumental task and responsibility as a board. I would like to see Carrie's credentials and where she's been, so then we as a board can know if we need to give her more tools in her tool belt in terms of resources from somebody that might be, I don't know what your background is, wellness programming and things of that nature. So if we could have that in the meantime, before the next board meeting,
So looking for a copy of her CV?
Yeah, just what
Absolutely.
your background is and your strong suits and so forth. And then where you think you know, if you want to just send us some bullet points of where we might be able to best support you as well, because that's our job, so.
It is their job.
And are we going to still be able to utilize Sheila?
Maybe Sheila should explain her new position to
I
us.
would like to maybe get an explanation, because it's like a very new position, and I'm not exactly sure what the purpose of it is.
Correct. So
entirely.
the Department of Health is creating a team of subject matter experts at the different regions of the state. And so within that team is an administrator, and my role will be to support the local health departments, be there kind of to act as a liaison between the local health department and the Department of Health, to get them answers when they need it, to quickly guide them to the right people and the right resources. And then under that position, there are several other positions. I don't have the exhaustive list, but I know it includes an attorney, emergency preparedness, food safety, environmental, public health nurse, school liaison, qualities, data analyst, data analyst, and possibly a couple other that I'm missing there. So definitely, that is one great thing about the fact that I'm taking this position, is Carrie can call me anytime to say, hey, what about this? How does this? It's not like I'm just disappearing, and she's not going to be able to contact me.
Yeah, excellent.
You're not moving, are
resource.
you?
I am not moving.
Yeah,
No.
I guess I should have specified that she most specifically took the northern regional position, because there are 3 within the state.
Yes.
So she could have disappeared and gone to the southern regional position, but she will be in the northern regional position.
And how greatly that speaks of you and this health department, that you are chosen amongst of all the counties and all the health departments to be one of the 3 leaders in the state.
Thank you.
Just speaks so much to you and all of you who work at this department. I'm super proud of you.
Thank you so much.
Yeah.
We're only letting her go if she promises to take our calls first.
This is being recorded. I'm not going to say
That's phenomenal.
thank you.
Congratulations.
Thank
It's hard
you
to
so much.
see you go.
And congratulations, Carrie. All right. So at this time, we can open up to public comment. I know there's a sign-in somewhere, right? Where was our sign-in?
It's right up there. It's right up there.
All right. And so we're going to try to limit, if anyone needs to speak, to 3 minutes.
Somebody on the sign-up sheet?
Is there anyone?
one yet. Okay.
All right. Then motion to adjourn our meeting.
I motion to adjourn.
Thank you. Second? All in favor? Awesome. Thank you all. Yes.
Isn't that terrible?
But I mean, like,
Hard. So hard to.